My name is Beverly Canada. I'll be talking to you today about prostate cancer. 1 in 4 deaths in the United States is from cancer, and 1 in every 9 men will be diagnosed with prostate cancer in their lifetime. So in the United States, there's 200,000 people that will actually experience prostate cancer and be treated for prostate cancer. And some information about the prostate: it is only located in men, not in women. It's about the size of a golf ball. It helps with reproduction and the flow of urine. It is a very uncomfortable subject for a lot of men to talk about, so it is actually a job for women also to address this, to talk about this with their sons or their husbands or boyfriends, just so they are a little bit more aware of what could happen. There are a lot of risk factors that can contribute to prostate cancer. A lot of it is just lifestyle. If you lead a healthy lifestyle, that also helps your body combat any type of cancer or foreign substance that can put you at higher risk for cancer. So it is a very slow-growing cancer. Some of the predisposing factors are: if you're above 50, you're at higher risk. If you work at a job where you're exposed to a lot of heavy metals, irritants, dust, fumes, anything that your body can see as a foreign object. And smoking and alcohol is also a huge contributing factor to cancer at all times. The PSA is one test that can be done to check for cancer as just a very beginning screening test. The Centers for Disease Control also does list being African American as a predisposing factor, since there are more African American men that are diagnosed with prostate cancer. So some of the symptoms of prostate cancer: in the very beginning, there may be no symptoms, none at all. And as the cancer progresses, there may be burning, paining with urination, difficulty urinating, blood in the urine, loss of bladder control, and then at night, some men may experience just constant feeling the urge that they have to urinate. And then as the cancer progresses, you would have symptoms such as erectile dysfunction, swelling, and pain in the thighs and in the hip and the back, as the cancer might spread into the bone area of the body. Also, one of the tests after a PSA might be a rectal exam, and the doctor would feel a hard nodule about the size of a pea, and that can be an indicator of prostate cancer. So after a PSA is done and a nodule is felt with rectal exam, a biopsy can be done with a needle to aspirate some of the fluid to check it for cancer. And then an ultrasound is also done to try to detect any type of abnormality in the prostate. So there are several approaches to the treatment of prostate cancer. The easiest one would be just a wait-and-see approach, where the cancer is so slow-growing that no treatment would be needed. And then also chemotherapy or radiation might be needed, biological medications to stop the spread and the growth of the cancer, or surgery to remove a very cancerous area. So treatment does depend on the stage of the cancer. Now, the Cancer Treatment Centers of America gives many tips to better tolerate the treatment of cancer. And some of the tips are to just really communicate with your doctor about pain control. There's a lot of pain medications that can help with pain. Make sure your appetite and fluids, adequate fluids and adequate food, medications for nausea and vomiting, and the side effects that come with chemo can also be combated with medications and specific foods that can be tolerated. But number one is just communication with your doctor about your pain control. And the Prostate Cancer Foundation states that no man undergoing treatment for prostate cancer should take any other medications besides what the doctor prescribes. There are medicines out there that are considered cancer supplements that are over the counter, but none of that is recommended. So the lifestyle changes that can influence the diagnosis of cancer and the treatment of cancer are to always just try to be at your most optimal health, such as a good weight, not smoking, eating less red meat, eating more fruits and vegetables, just a very healthy diet, Exercising 30 minutes a day is recommended, and then limiting the fat, sodium, alcohol in your diet. And really, diet is the very best method to optimize your health and to combat cancer so that it doesn't become a problem. And it is an awkward conversation that men don't want to have, but it is a necessary step and a necessary way to avoid a diagnosis of prostate cancer. Thank you.